physician assistant today. We're going to be doing a physical exam of your heart, lungs, skin, and peripheral vascular system. Is that okay?
PA? I thought I was seeing the doctor.
You wish. You're stuck with me today. It's fine. All right, so we're going to start with the heart examination. I'm going to raise the head of the bed up here for you. And I'm going to scoot down. Lie back on the table. Now, this is one thing I'm going to interject. Please, 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 hold out the footrest. Okay? Have any of you ever laid back on an exam table with your legs still dangling? It's really uncomfortable, and you feel like you're going to slide off onto the floor. So, pull out the footrest. Whenever you have a patient lie back, pull it out. Okay. So we're going to start with listening to your heart. Start here at the right second intercostal space, listening to the aortic area. Move over here to the left second intercostal space, or pulmonic area. And then down the left sternal border at the third through fifth intercostal spaces, or the tricuspid area. And now at the apex, we're going to listen to the mitral area. Thank you so much. I'm going to have you sit on up for me. I'm going to have you scoot to the front of the table. We're going to be listening to your lungs, okay? I'm going to be listening in 14 spots. Every time I put down my stethoscope, I want you to take a big breath in through your mouth and out, okay? And we'll give you a couple of pauses in between so that you don't pass out on me. While I'm listening to your lungs, I'm going to be listening to the pitch, intensity, and duration of inspiratory and expiratory sounds, as well as the presence of any adventitious breath sounds like wheezes, rhonchi, or wails. Big breath for me. Take a break, just breathe normally. A couple of breaths, normal breaths for me. Last two. Thank you so much. We're going to move on to the skin portion of the exam. We'll be inspecting your skin generally at first, looking at the color, noting any areas of erythema, cyanosis, or jaundice, as well as any areas of hyper or hypopigmentation. As I do my exam, I'm also going to be looking for any suspicious lesions. I'm going to be applying the ABCDE mnemonic of melanoma to any of those lesions. S stands for asymmetry, border irregularity, color, diameter, and any evolution of lesions. Yes, I think I've got that. Okay, so I'm just going to be looking first and foremost, like I said, inspecting the skin, which is a place I can see. Can you go ahead and lower the neck of your gown down to your waist? Inspecting the chest and skin of the abdomen. Great, thank you. Raise that back up. Maybe stand down and then turn around so I can see the back side of your body, looking at the back and posterior legs. Go ahead and sit back down. All right, now we're going to just assess the temperature of your skin, upper and lower extremities, looking for any generalized or localized areas of warmth or coolness. Also going to be palpating the skin for its moisture and texture. Now we're going to move on to the hair and scalp examination. We'll be looking at the distribution and quantity of the hair, as well as any lesions that might be present on your scalp. And while I'm doing this, I'm also palpating the texture of your hair. Thank you. We're going to move on to fingernails and toenails. Put your hands out like this. I'm looking at the shape, color, and presence of any lesions on your fingernails. Also feeling the texture. And while we're here, we're going to go ahead and do capillary refill. So I'm going to squeeze your fingers, looking for the refill of those capillaries. Excellent. Do the same thing down here in your toenails, looking at the shape, color, and texture, presence of any lesions, and palpating the texture of your toes, and we'll do some capillary refill testing as well. Excellent. Thank you so much. Now we're done with with the skin, hair, and nails portion of the exam, we're going to move on to peripheral vascular exam. So we're going to be looking at your upper extremities first, from the shoulder down to the fingertips. I'm assessing the size and symmetry of both arms, noting any areas of swelling. I'm also looking at the venous pattern and the presence of any prominent veins. Yeah. Now we're going to move on to feeling your pulses. So I'm going to start here with your radial pulses. Everything just hold your hands just like that. Perfect. Thank you. I'm going to feel the brachial pulse here. And then on the left side, I'm going to palpate your epitrochlear lymph nodes. So right here, I'm just going to make some circular motions like this. Thank you. And on this side, same thing. Thank you. Okay. I'm going to have you go ahead and slide on back. We're going to have you lie down flat. Move on to the lower extremity. Oh. False. I'm going to have you sit back up. Okay. Now we're going to move on to the lower extremities, from the groin down to the toes. Again, I'm looking at the size and symmetry of your lower extremities, looking for any areas of swelling. In addition to looking at the lower legs, the distribution of hair on the lower legs, feet, and toes, assessing for the presence of any varicosities on your lower legs, and also looking at the pigmentation of your lower legs, including any rashes, scars, or ulcers. Thank you. Okay, now that we've done our inspection portion, I'll go ahead and have you lie back flat on the table. We're going to move on to the pulses. So I'm going to start with the femoral pulses, which are right here in your groin, okay? Good on the right side, present on the left side. And I'm going to also feel for any inguinal lymph nodes, okay? Those same areas. Okay, now let's move down to the popliteal pulses or popliteal pulses. Right, and do it on this side. Thank you so much. I'm gonna have you sit back up and scoot again to the edge of the table. And come down here and palpate for the posterior tibial pulses. Now checking the dorsalis pedis pulses. All right, while I'm down here and check for some edema as well, so we'll be pushing on the tibia bone, as well as here on the lateral malleolus. And while I'm here, I'm also inspecting pigment. Is this the pigmentation part? No, this is oh yeah. So I'm looking at your lower extremities while I'm down here for the prominence of any veins, tendons, or bones. Okay? So we're going to feel on both sides here. Perfect. The last thing that we want to do is something called the Allen test. I'm just going to take your right hand. I want you to put it up like this. Good. I want you to make a big old fist for me. I'm going to check the patency of the arteries that feed that hand. So I'm going to squeeze these off like this. First, we're going to check the patency of the radial artery. So I want you to open your hand up nice and slow. Good. I'm going to release that one and look for the blood to fill back in. Excellent. Go ahead and make a fist for me again. Squeeze those both again. And open your hand. I'm going to release the ulnar artery and make sure that we've got good blood flow back. Excellent. Thank you so much. And that's it. Okay. What did I miss?
First and last name. You only did the first name.
My name?
Yeah. And then.
I always say Ryan.
I forgot power for your moving colors of the skin. You just said erythema cyanosis or jaundice.
Okay. Here's one thing I want to note as well. We grade on a 50% mark. Okay, so if you hit 50% of the things, if there's something that's in a list, if you hit 50% of those things, you get full credit. If you hit less than 50%, you get no credit. Okay? So just know. But trust me, it's a lot easier to like memorize everything. And then if you accidentally forget a couple, then you've got a little bit of padding, okay, rather than like only memorizing half of them. Trust me, just try to memorize all. Okay.
So you skip order then.
Oh, splinter! Dang it! I knew I'd missed one thing.